Welcome to our webinar, which is part of Health and Safety Month, the NEU's Health and Safety Month this November, which has been a brilliantly organised event, I think. And this one is on air pollution with Hilda Palmer. So we're going to have approximately half an hour of a presentation with Hilda this afternoon, followed by some questions and answers and a bit of discussion. So thank you very much to Hilda for coming, and thank you to all of you attending all these events throughout the month. Now, to introduce Hilda Palmer, she's worked at the Greater Manchester Hazards Centre for 32 years. She helped to set it up in 1987 in order to provide free independent information, advice and support to workers, safety reps and community groups in the Northwest, and to campaign for better health and safety. She was also the chair of the National Hazards Campaign, which runs the annual Hazards Conference, promotes International Workers' Memorial Day and organises demonstrations, lobbying and harrying of government and HSE to address all the causes of ill health and death related to working conditions. Hilda also set up a Bereaved by Work group, which has now become called the national group Families Against Corporate Killers. She has in theory stepped back and is now in a supportive role for Janet Newsham, who took over in 2017. But it seems to us that she's as involved as ever, and we're very happy about that. Previously, Hilda worked as a teacher and was an NUT member in the UK and Zambia. And here's an interesting fact. Apparently her son was born under a mango tree in Zambia. The Hazards Campaign has recently brought unions together in the Trade Union Clean Air Network. And obviously that's a focus of our meeting this afternoon, air pollution. To me personally, I think Hilda is the epitome of what Health and Safety Month in the union is about. She constantly reminds people that poor safety management leads to death. And she knew that long before Matt Hancock did. Long before he even existed, she was there doing her work. So we feel really privileged to have you here this afternoon, Hilda. Welcome, and I hand over to you.
Thank you very, very much indeed. That's all far, far too glowing. And I should really emphasize that I really have stepped back. And my colleague, Janet Newsham, who some of you will know, has taken over from me, and in 3 years has made me realize how little I've done and how I should have been a great deal better. So I'm going to now share my screen. Okay, I want to talk about air pollution as a trade union issue in the Trade Union Clean Air Network. And I also imagine that possibly we should also talk a bit about COVID, because COVID is an issue of air pollution. COVID is in the air. And I think there are ways in which we have to look at integrating that into our work in terms of trying to get a better environment in our workplaces, and use it to do a lot more about recognition that air pollution is harmful to our health, and that better ventilation and all the rest of it is really important. So I'm going to touch a bit on that. I'm going to try and buzz through my slides quite quickly. You can all have them later. They're really so you've got something to look at rather than me. And I just want to sort of draw people's attention to some very sort of key issues. But this is very much about the fact that air pollution is a public health issue, but it's been an occupational health emergency for many, many, many years. And to re-emphasize that we actually live and work in a toxic cocktail of chemicals about which we know very, very little. They're all interacting with each other. Most of them have never been tested properly on human health. Most of them have never been tested for how the effects they have on us when they're mixed together. The effects on young people, the effects on the developing fetus have not really been looked at, all those sorts of things. So this is a very important issue. And I believe that we need to have integrated action to be looking at reducing toxic substances at all levels, in workplaces, in our own homes, in use, so that we're all exposed far less to toxic chemicals, toxic dust, toxic particles, toxic fumes, all the rest of it. And trade union involvement and work at work and outside is, of course, absolutely vital. And this campaign on Trade Union Clean Air was set up as a collaboration between the Hazards Campaign, the University and Colleges Union, UCU, and Greener Jobs Alliance. Okay, so, you know, we now know, everybody, we now know air pollution is a big issue because External traffic pollution has become a very big issue, and we now accept that anything between 36 and 40,000 deaths a year are caused in the UK because of this external traffic pollution. But that is also a workplace and therefore a trade union issue. And obviously it directly affects workers, those who work in traffic, who are drivers, who work or are outside workers, who work on the roadside, who work in construction, those working with vehicles inside workplaces and train stations, bus drivers, taxi drivers, everybody else, delivery drivers, all those sorts of things. And then indirectly, for all of those people who are working and going to school and commuting to work or living on polluted roads, because the internal air comes from outside. And a lot of work has been done on looking at air inside buildings, particularly primary schools and other schools on very busy roads. And they've actually found that the pollution inside those places, because it's trapped inside due to poor ventilation and all the rest of it, poor construction of buildings, that the pollution inside that workers and children have to be in all day is actually much worse than what is outside. So it's a very, very important direct and indirect issue. But we mustn't forget that there's lots of non-traffic air pollution created by work activities, which affects workers when it gets out and affects the public, or whether it affects other workers. You know, all the things from factory fumes, incinerator plumes, energy generation by coal and gas, and biomass. Some of you may live in areas or work in areas, particularly in urban areas, where having a wood stove has become a very higgy, wonderful, cozy thing. And in fact, the fumes from wood stoves in London make up a huge percentage of the particles in the air. And in fact, the expansion of wood stoves in homes, purely for their sort of coziness rather than for as an economic heating decision, actually, you know, wiped out a lot of the gains of the first waves of the congestion charging. So those things are very important. They might be a big issue in the areas in which you live or work, and depending on the sort of activities that are going around schools in which you work. And I think it's very important to think of all those other sources of air pollution. And also there are lots of sources of work-related air pollution inside schools. So air pollution is an occupational and public health emergency. I just want to sort of draw your attention to the fact that hundreds of thousands of workers are made ill and tens of thousands are killed by hazardous substances at work every year. And they're all utterly foreseeable and preventable. And we estimate about 18,000 work cancer deaths from chemicals, asbestos and shift work. And asbestos is a particular issue for you as teachers. Several hundred teachers that we know of and other school staff have died from exposure to asbestos. And we know that the estimate is that for every staff member in a school that dies of asbestos, maybe 9 children who are much more susceptible to exposure to asbestos when they're young and developing may well go on to die later. So it's a very important issue. It's a very important issue in our schools, which are mostly old and crumbling. They have asbestos, which every year is getting older and older and more damaged by leaks and the general use of the building, and asbestos fibers may well be in the air. 20,000 deaths from heart disease, and a lot of that is caused by chemicals, dust and fumes. 12,000 deaths from lung, neurological and other illnesses, you know, asthma, constructive pulmonary disease, and all the rest of it. And obviously masses and masses of illness. And then we include the external pollution in that. So the health effects of air pollution, it's becoming clear now that almost every cell, every organ and every system in the body can be affected by the chemicals and particles in air pollution, because there are so many of them and we still don't know about all of them. Obviously lungs, we can have things like asthma, COPD and lung cancer. The endocrine system can be massively affected. These are the glands in your body that produce hormones that regulate all the activities in your body. And diabetes is very much linked to air pollution. The immune system can be damaged by making it less active or making it hyperactive, so that we have an explosion of autoimmune illnesses. The reproductive system can be particularly affected, damage to both male and female reproductive system, but particularly premature births, low birth weight children, birth defects, Air pollution can affect the development of the fetus, and it can damage the chromosomes and DNA in the developing fetus, so that the chromosomes are affected in terms of how the cells divide. And this can have a massive effect on reducing the life expectancy of people. So you see, the effect of air pollution actually happens at a very early stage, and we have more and more information now that very small particles that can be inhaled and can get across the lungs into the blood can actually then get across the placenta and into the developing fetus. And also they can get across the blood-brain barrier. And we have a lot of information about cognitive decline, which happens to adults to some extent, but also is sort of programmed in by the damage to the developing fetus from air pollution. And issues like dementia can also be made worse by it. The heart can obviously be affected in terms of strokes and cardiovascular disease. And so the air pollution can cause genetic mutations, endocrine disruption, reproductive harm, and cancer. So it's an absolutely massive, massive problem. But while we're all at risk, we're not all in it together. We are all at risk at home, at work, at school, and in the environment. While we're working in traffic, while we're driving, while we're commuting, all those sorts of things. But some people are much more at risk. There are double, triple whammies. Workers in the worst jobs are exposed at work. They often live near the worst traffic pollution. They often live near older industrial contaminated sites. They have children at school in the most polluted areas. So income, class, race, and sex discrimination inequalities actually just make that all the more toxic. The poorer you are, the more likely you are to be affected in all of those sort of places, and that effect will be cumulative, additive, and extremely damaging. Children we know are amongst the worst affected. They're smaller, they're closer to car exhaust, and their growing bodies are more susceptible to many pollutants, particularly vulnerable to asthma, reduced lung capacity, impaired brain and other development, and so on and so on. And so we're programming in really serious later life ill health effects and inequalities by exposing our children to air pollution. So it's an equality, social justice, just transition, and fairness issue. It's about workers and our children, our families, and our future, and that makes it a trade union issue. I think I should just explain just transition here. Well, I'll explain that a bit later, I think. Okay. So this is really the background to why we set up the trade union clean air campaign, TUCAN. And we set it up a few years ago. We've got a fabulous logo, which we'd love people to use. I think it's absolutely brilliant. That's Janet Newsham for you. She's an absolute whiz at things like that. We got most of the trade unions on board, including the NEU, in terms of developing a clean air network charter, which you can read about, which includes all the demands that we have. And we produced some safety reps guidance. Basically, we're asking for a new Clean Air Act enshrining the right to breathe clean air everywhere at work too. We want the health and safety at work law updated. We want to ensure effective enforcement. We want the workforce involved. We want to protect jobs. And we rapidly want to expand clean, cheap public transport systems. We need to protect jobs. I should just explain that. That's maybe what we mean by just transition, in that all the solutions to air pollution must be evaluated in ways that have an equitable outcome. It's not great to put, for example, cycle lanes on a busy road next to a primary school, which slows down the traffic, so it's idling through there on the rush hour twice a day, shedding much more pollution around the primary school when the actual cycle lanes are very poorly used. It's not good to make some areas low traffic networks if that displaces the traffic onto other areas. And those other areas are much more likely to be where poorer people live. All the solutions must also protect jobs. We want to get rid of polluting vehicles, but we want those people to have jobs that are involved in producing better vehicles, better products. We don't want anybody to lose their job as a result of this. This can't be a punitive sort of thing. So our fact sheet for union reps is really good at dealing with, all the things that we think you could be doing and should be doing, with a checklist about how you can get started, with lots of links, and that's a really useful resource. Just a few things just to remind you of what I said, you know, that the pollutants come from lots of different sources. DEFRA actually has some very, very good posters showing, you know, that the pollution in the air comes from traffic, it comes from agriculture, it comes from domestic fuel, it comes from industrial processes, you know, it's actually everywhere. It's really important to remember that and to look at it, because it depends where you are as to what might be the most important. And we're looking at things like sulfur dioxide, we're looking at volatile organic compounds, we're looking at nitrous oxides, and we're looking at PMs, particulate matter, the small particles. It's really important to realize that particulate matter, 38% of particulate matter actually comes from solid fuel. And there's just a really good graphic that actually shows you what an open fire emits, what a non-DEFRA stove emits, what a DEFRA stove emits, and how all of that is actually adding PM 2.5s to the air, and that's really important. We see here that particulate matter, the 2.5 microns, I'll come on to that in a bit more detail in a minute, that 38% of them actually come from domestic wood and coal burning, you know, whereas only 12% come from road transport. So we've got to look at the whole issue here. Ammonia is an issue as well from agriculture. Nitrous dioxides, obviously, most of them come from road transport. So reducing traffic is very, very important. Non-methane, volatile organic compounds come from all sorts of sources. The chemicals used inside buildings, things that off-gas from furniture, from upholstery, from carpets, from cleaning materials, from beauty and cosmetic products, from you know, deodorants and all the rest of it. All those sort of things release volatile organic compounds into the air, which are also part of air pollution. These are just a list of all the things that are in diesel fumes, huge number of things, all of them really unpleasant and harmful, some of them carcinogens, some of them mutagens, some of them reproductive toxins, all very, very dangerous and also containing very small particles. And diesel fumes were classified as carcinogenic by the International Agency for Research on Cancer of the WHO in 2012. We've done a lot of work on diesel. Hazards Magazine, which if you're a safety rep or you're at all interested in health and safety at work, you should definitely get a subscription to for your branch and for your role as a safety rep. It's one of the most important tools you'll ever use. Fantastic information there and links to the dangers of diesel fumes and what can and should be done about them. And the fact that, you know, we were saying this 30 years ago, and it was a very wrong decision when the Labour government, unfortunately, you know, chose to support diesel vehicles over petrol vehicles, thinking they were better for reducing carbon dioxide. If we look at the exposure levels, we know, you already know in your union, that there are thousands of schools across the UK where, in areas where the pollution levels in the air are illegal. They exceed the legal limits that are set. But it's very important also to realise that legal limits are not health-based limits in themselves, and they are also almost all of them too high. If you just look at the particulate matter, the PM 2.5s and the particulate matter PM10s there, it gives the exposure levels in micrograms, millionths of a gram per cubic metre, for the UK, for Scotland, and it gives the WHO level. And in most cases, Scotland has the same level as the WHO. England's level is much too high, more than 2.5 times higher. But even the WHO will say that there is no safe level for PM 2.5s. All levels are potentially carcinogenic. There's no safe threshold. So these exposure levels are really important. It's really important for you to find out what is the level outside your school and also inside your school, and to use these charts and these legal limits to help you to find out that information. But it's also important for you to realize that's a starting point and that no level really could be considered safe, and you're always trying to get it to the smallest, the lowest possible level. And nitrogen dioxide level is there at the bottom. So that's quite important. This is just to show some of the exposures to particulate matter from different sorts of road users. The pink highest graph level there is a taxi driver. The yellowy green level is a cycle courier, and the office worker just walking to work is the blue level at the bottom. I think that's quite important. People often think that the people inside vehicles are not really exposed, it's only those people outside, but that's actually not the case, and that's something we need to use in all of our campaigning. Size matter, and this is just a quick diagram to show you what we mean when we're talking about these different things. PM just means particulate matter. 2.5 is 2.5 microns, or 2.5 millionths of a meter. And if you look at that diagram, it shows you PM 1 micron, PM 2.5, PM 10, and it shows it compared to a human hair, which is about 100 microns. And then it shows mold and beach sand, table salt, and so on. So it just shows you what we're talking about. Tiny, tiny, microscopic particles that we cannot see, but probably fill the air. There's so much sort of in the air, and this links with issues to do with plastic pollution. We can see lots of plastic in the sea, we can see it blowing around, but all those plastic products actually are degrading and breaking up. Every time you take off a fleece, or a lot of our clothes which are made from synthetic fabrics, very, very tiny microfibers, plastic microfibers are released into the air. Every time you break, plastic microfibers are released into the air. These fine particles are everywhere in the air, and they have the potential to damage your health. There's no such thing as nuisance dust. This just shows a diagram of someone's lungs and just explains that anything up to 100 microns can be inhaled into your nose and throat, although it might be filtered out, but it can still do damage in those areas. And that's important when we're talking at the moment about COVID, because lots of the droplets are up to 100 microns and we're inhaling them into our nose and throat. And that is where they're actually doing some of their damage and infecting us. And then there's dust that gets further down into the lungs, thoracic dust, respirable dust, which gets right down to the lower levels and then can be absorbed into the blood and get everywhere around the body. 0.3 microns are so small they can just be absorbed straight through the skin. This is just to explain that in a little bit more detail. This is just from my COVID slides. This is just a picture of the lungs with different colors. And then if you look at the graph, those different size particles in different colors, you'll see the one marked alveolar, the sort of red one. Those are the ones, the tiny ones, which get right down into the bottom of your lungs and can do the most damage. The blue ones tend to stay in the upper respiratory tract or are filtered out, and the intermediate ones get down into the sort of middle of the lung. So our trade union attitude to all of this is that workers are the canaries in the system. We're often exposed first, exposed most, and protected last. We must use the precautionary principle. Legal limits aren't safe. The only safe limit is zero. And we need to use the laws that we actually have to actually get rid of these chemicals. So what you can do in your workplace? Well, find out what substances there are in your air. You need to make a list. Find out what's naughty and nice. Make an inventory. List all the substances. Find out what's coming in, those things that come in with safety data sheets like the cleaning materials. Are there substances in the fabric of the building, like asbestos, like VOCs in the furniture? Air pollution outside, we need to find out what that is. Are there microbes in the air, fungi, molds, and now, of course, viruses, SARS, the COVID virus, dusts and particles? We have to find out what they are. You can use your Safe Reps and Safety Committee regs rights to ask your employers for the list of all the hazardous substances. And you can ask for the risk assessments. You can talk to workers, use surveys, find out about indoor and outdoor air pollution measurements. If they haven't been done, ask for them to be done. Part of your rights in terms of representing and protecting workers. You can carry out inspections and you can do body mapping. You need to set yourself out an action plan. Find out what's going on, find out what the issues are, map out the work hazards in the building, make a body map to find out what the problems are. Find out what law you can use, who's exposed, how and where, find out what help you've got, all those sorts of things. The law we're protected under, we've got the health and safety law, we've got the Safety Reps and Safety Committees law, we've got some environmental law as far as that's useful. The Health and Safety at Work Act is the duty of the employer is to ensure, as far as reasonably practical, the health, safety and welfare at work of all his employees. And then we've got the Management of Health and Safety at Work regulations on risk assessment, and the control of substances hazardous to health particularly. That's really important, the COSH regulations. And the COSH regulations really say that the employer must risk assess all substances and prevent exposure of workers to all substances that might harm their health. If they're harmful, then they must eliminate them or substitute them with something safer, or they must use engineering or other controls, and only as a last resort use personal protective equipment. That's all what the law is. And obviously we'd say you must get rid of the most harmful chemicals first. I'll just very quickly talk a little bit about COVID. The health and safety law applies to COVID, and what we should be doing is applying the hierarchy of controls. We should be trying to eliminate it, working at home, people working at home, remote learning as far as possible, which keeping people away from the exposure to other people who might possibly have it. And then we're looking at engineering controls, ventilation, and so on, administrative controls, and PPE only as a last resort. If you can't control exposure to COVID in the workplace by those other methods, then your employer is under a legal duty to provide you with PPE, personal protective equipment, not just a face mask, personal protective equipment, an FFP2 or an FFP3 mask. I know there are problems with that. We know about transmission, direct contact, indirect contact, large droplets and small droplets, called aerosols. And this is really important. COVID is in the air, and this aerosol exposure, which can happen over a long, long distance, because once they get in the air, they'll act like smoke, act like cigarette smoke. And this is why we have to look at, I'm not going to go through all these, you can have them in my slides, and I have a more detailed presentation if anybody's interested. But the role of ventilation is to remove the stale air and replace it with fresher outdoor air. And this, I think, is important for COVID, but it's also important in terms of air pollution outside. So we're looking at air coming in and going out, and what it must do. It dilutes the stale air. It brings new oxygen, it removes carbon dioxide, it removes moisture and microbes. And what you can add to that are filters that can filter out the microbes and filter out some of the particles from air pollution. And there are portable air filters that can be used in classrooms, which can actually draw the air in, filter it, and then pump it out again. All of these sort of things are actually possible and are important in terms of COVID, but they're important also in terms of other air pollution. Then there's things like using UV ultraviolet light in the either ventilation system itself or in the top of the room to actually kill off the virus. That won't help in terms of other particles. It won't remove air pollution, and it mustn't be used at a lower level, and you mustn't use ionizers because they can be very dangerous as well. So I'm not going to go into all of those things, I think, but we have a lot of information. Face masks do work. Visors aren't any good on their own because they don't filter out the aerosols. But if everybody's wearing a mask, we need layered controls. That's what's important. If you have no interventions, then you've got droplets, you've got surfaces being contaminated, and you've got aerosols spreading a long way. If the children are wearing masks, should they be infected, that's source control, and it's preventing a good deal of the aerosols and droplets from getting out and protecting everybody to some extent. If you use ventilation and filtration, then you're removing more of the aerosols. If you're keeping people at a distance and you're using masks and you're using PPE, that's preventing some more. Using hygiene as well, and then using all the interventions together is the way in which we are making work safer. And there's a really good risk matrix there just to show you that. Face coverings inside and outside, and the impact of being silent or speaking or shouting or singing, and the number of people in a room and whether it's ventilated or not leads to the risk. And these are the sort of things that should be taken into account when your employers are making those risk assessments. So I'll leave it there. I'm sorry I've gone on a little bit, but I hope that's been useful, and I hope now we can have a good discussion. Thanks very much.
Thanks very much. That was a really fascinating presentation, Hilda. We have a few questions that have come up here. First one, I'm a supply teacher who is finding it hard to get work these days, and consequently, I'm very short of money. I recently bought a small car from a friend for next to nothing, but it's a diesel, and I'm very conscious of particulates, etc., that I'm producing. I need a car to get to work in different schools. I live in a very rural area with a poor bus service, but beggars can't be choosers, and I feel I'm stuck with my diesel car, although I feel guilty driving it. Any advice?
Oh, that's really, no, that's really hard. And this is the problem. This is what, and when I talked about just transition, I should have said a bit more about this. I think this is really, really difficult because the poorer you are, the more likely, and I include myself in that often, the more likely you are to have to buy a second-hand car that actually is more likely to be polluting. And at the moment, is more likely to be diesel, as people who've got more money are buying electric cars and hybrid cars and are, you know, putting their diesel cars into the second-hand market, and they're actually quite competitive. That's understandable. I think try not to feel too guilty. It's not your fault, you can't help it. I think, and you can't, all you can do is to maintain it to a reasonable standard, use it as little as possible. Yeah, in a rural area, what else can you do? Of course you've got to drive a car. I think there are quite a lot of advice about driving, where if you drive carefully, if you drive at a reasonably, you know, you don't speed up and slow down, you don't do a lot of braking, you release slightly less pollution. And also thinking about yourself, because there will be pollutants inside the car. So you could think about wearing a mask, and you could also think about always having the window open. But that's probably good advice now in a period of COVID as well. But I try not to feel too guilty about it, because, you know, we all have to do it. And you know, that's just the reality of it. So don't feel too guilty.
Okay, next very difficult question. Taking into account the risks of school children being outside when pollution levels are high, or indoors because of poor indoor air quality and coronavirus and needing to ventilate, how do schools weigh up these relative risks?
That's a really, really good one. And I think the most important thing in all of this is to make sure that we as trade unionists and we as safety reps are absolutely in there having this discussion, and that all the risk assessments we should be involved in, and, you know, trying to work out and elaborate the level of risk. I think that that is an extraordinarily difficult question. I think at the moment we would have to say that even though the pollution levels outside are high and we would be uncomfortable about, and previous to COVID, we would be arguing for protecting our children from them, I think we would be saying, on the balance of probabilities, better outside than inside as far as COVID is concerned, and that COVID is at the moment the more acute risk. And that is not to say that the acute and long-term risks of air pollution are not also high. But I think that would depend on the exact nature of and level of the air pollution in your area. And I think that means getting accurate measurements. So I think you would have to collect all the local data, and depending on where you are, if you're in London, you can probably get very good data on what the air pollution is in your area. And I have to say, during lockdown, of course, it was very low. Now it's gone back up again, and it looks like it's probably high or even higher than normal. But you may not have that information, or you may want better information. And I think you need to ask your employers to actually carry out some surveys, get some sample tubes that can be put around the place to give you some idea of what there is outside and inside. Because you mustn't make the assumption that the level of traffic and other pollution outside is actually greater than what's inside, because from what I said before, often it gets trapped inside and it's also quite poor inside. So that's a very, very difficult one. But on balance, at the moment, I think we would say that outdoors is safer from COVID, and that is probably the most acute issue at the moment. But we're bearing in mind the fact that we're not tolerating or not happy with the levels of air pollution, which may have acute effects on some of our children who may need protecting from that, and may have long-term effects on all our children and some of us. I hope that helps. It's not an easy one.
Thank you. Can you expand a little bit more on, you just touched on the issue of face coverings versus visors, or both, or only one or the other. Can you explain,
Yes.
because we know this is an issue in some of our schools,
Yes.
where there's some heads insisting on visors, not masks, so your face can be
Okay.
seen, things like that.
Okay.
Yeah.
Okay. Well, I think, and I will send you, we did a whole webinar on this, and I will send you my slides and a link to the webinar. And we've just recently done a film with Real News, which has got some fantastic graphics, which actually explains all this sort of very well. There's been a lot of talk about how effective masks are. I think now there's enough evidence from observational studies and a lot of laboratory studies, particularly looking at aerosol and droplet ventilation, engineering sort of issues, which shows that almost all masks or coverings have some sort of effect. Obviously, the ones that have got 3 or more layers are better. The ones that have got a sort of filtering layer in the middle are the best. But all of the cloth masks, providing they're quite well made, that they fit well, and preferably have a sort of clip that you can make them a tighter seal around the nose, which if you wear glasses, you'll be very aware of and need to do. So that's very important. And also fit closely around here. Some of the better ones actually perform really, really well. So it's important that we encourage their use, and we challenge our employers, our schools, where they say that you must wear them in the communal areas, but not in the classroom, which is a communal area. That's ridiculous. Children are a risk to you, and as such, them wearing face coverings is actually really vital. There's also a lot of evidence now which shows that, whereas initially we were saying that face masks were not personal protective equipment, but public protective equipment, that they prevented you breathing out and infecting other people. There's now quite a bit of evidence to show that they're actually also quite personally protective and do protect you a bit. And obviously, from my slide where I showed you the layered protections, the more people who are wearing masks, the less droplets and aerosols in the air, so we are all more protected. But the reality is that if you're going to protect yourself, the wearer, and you as a worker have legal rights to that protection, if a risk assessment shows that you may be exposed to hazardous substances like the COVID virus, which is a class 3 pathogen, if the risk assessment shows that cannot be prevented by social distancing, by reducing the number of children in classes, I know that doesn't happen, by ventilation, by all the rest of it, that there is still a residual risk, then by law, you must be provided with personal protective equipment. And that means proper respiratory equipment that's properly fitted and face tested and is filtering and protects you specifically. It will also protect other people, but it's protecting you. And that means FFP2 face masks or FFP3. Face shields look great. They will protect your eyes. That's good. They'll protect droplets from getting on your face or maybe on your eyes. That's fine. But if you're more than 2 meters away from everybody, which you should be, then you shouldn't be getting close enough. That visor is actually really, really important. And wearing a visor on its own isn't any good. The aerosols will get up underneath and your aerosols will get out. And it's difficult, this. I know it's difficult. We all know it's difficult. But for your employers to say, okay, it's more important that we can see your face than that you are protected is frankly not acceptable. Some people are wearing masks underneath and the visor. Well, that's better. And I think we've all got better at understanding each other through masks and learning how to communicate while we are wearing a mask and someone else is wearing a mask. And I think it's something, that can be overcome. Or maybe we need to be looking at face sets, or, microphone or whatever. I think it's difficult, but I think we mustn't just accept this. We have to challenge all the time and say, this is a problem. How are we going to solve it? This is putting us at risk. Does that help?
Yes, I think we all want to take you into our schools with us, Hilda.
Oh, I'd love to come in there. I'd love to come in.
Appreciate. Okay, another question. Head teachers are sending home all pupils in a classroom if there's a confirmed positive case, but they're not necessarily asking all the staff to isolate. Do you think that not asking all the staff to isolate is increasing the risk to pupils in the other classes that they teach?
It certainly is. It's a complete and utter nonsense. I think it's criminally negligent. It's criminally irresponsible. It's utterly nonsensical, non-scientific, and illogical. And it's policy-based evidence making. The evidence is that people who are exposed should be isolating. When you say that whole classes are being sent home, that was happening very much at the beginning, and it may still be in some places. But in a lot of schools now, if one person is suspected of having it, a child is suspected of having it, then only those few children who are within 1 or 2 meters of them are actually isolating. As I've just told you, as you now know, it's in the air. That is bollocks, and I hope that doesn't breach any of the NEU procedures there. I'm sorry, that is absolute nonsense. And it is putting the staff at massive, massive risk. It's putting other children at risk in other classes. If you wanted to design a method for spreading it, that is what you would do. And we have to challenge employers whenever they are doing this. They're under huge pressure because the government has a fetish about keeping schools open. They're keeping schools open as childcare so that the parents can be at work. It's a purely economic thing. It is not about schools being safer. So it is wrong to be doing this. And it will increase the spread and transmission undoubtedly. It's designed to do that. And it is utterly reprehensible. Every time any of this thing happens, you must be documenting all these cases and the teachers involved. We must be developing a paper trail for later use in terms of learning from this, perhaps in terms of any compensation claims, or in terms of any cases against our employers for not actually protecting our health, or to reinforce our case. We must be documenting this. This is reprehensible. It's against all public health advice. The trouble is, we don't have independent public health organisations. Public Health England, which is now called something else, which I can't remember, and it'll be equally execrable. And the Health and Safety Executive, which has decided to hide behind PPHE, put its hands over its eyes, its ears, and its mouth, and do absolutely sod all. None of them are standing up and supporting teachers. And this is really, really dreadful. And they are allowing these very, very dangerous situations to develop in schools. It's absolutely wrong. And I think what's also been revealed last week, which has been going on for a while, and the Hazards Campaign has been revealing, is that the occupational, what is it called? The ONS, the Office for National Statistics, which produces weekly reports of various types on the COVID pandemic. They frequently break up categories of things and then present them in ways that minimizes the effect of work on the COVID pandemic. And what they have done in some of their latest publications is that they have segregated different types of schools, primary, secondary, and then different types of teacher, and broken them up in a way that minimizes the effect of COVID on teachers and on education. And if you look at them properly, as people have done, it shows that it does not back up the lies we're being told that schools are not a hive of COVID, that teachers are not very, very much at risk. Teachers are some of the most at-risk workplaces. And this is not coming out in those statistics, and there's a big challenge going on at the moment. Your union and other unions are taking this up. So None of that actually stacks up, but that still leaves you all in this very difficult position, because the government has given information, given advice and guidance to Public Health England, to the HSE, to local authorities, to do various things which actually go against what was established as proper public health procedure in order to break the chains of transmission, and when you had a case, to actually identify and to isolate all those people who might be affected, which should mean everybody in that classroom should be isolated and tested for a period. Why aren't they doing it? Because all the schools were closed. But that's up to us to actually be challenging that and publicizing that. And I'm really sorry that you were all facing such horrible conditions.
We all totally agree with everything you're saying, Hilda, and I'm getting feedback on the chat and privately on some of the things you're saying. Just to share some of it with you, several people are in a situation where not even the whole children are, not even the whole class is isolated when there's a positive case, regardless of whether it's staff or student that test positive. We know that heads have been given advice which goes against their own risk assessment that they've drawn up in conjunction with the union reps in their building. They've done everything properly, and we know that you agree with us that health and safety law has to be followed, and the risk assessment should always trump any advice that's given from a call centre run by unqualified people because it's been privatised and run by the government's cronies kind of thing. So that's that one. People agree with you that it's all bollocks and believe that that's completely in line with our union protocol, to use that word because of the context that we're in.
It's a technical term. It's a technical term.
Absolutely, absolutely. And it really good advice to document everything in relation to this poor advice that's been given, not only for future deaths, but also future ongoing health issues that people may have as a result of long COVID.
Oh yes, please, definitely. I cannot emphasize that enough. We must not always talk about deaths, because we don't know. 10, 20, some people say 50% of people who've had it even quite mildly may well go on to suffer really, really severe effects in one or other of their systems. And that's going to be an absolutely massive case for the future. And it's going to be worse in teachers because of the extra impact of the immense stress that you are all being placed under, which I am quite sure will act synergistically with all of that and will mean, you know, burnout plus long COVID, I think will mean something terrible for the future. So yes, it's illnesses as well, absolutely.
And also worse because some of the awful policies that we have operating in some of our academy schools and things about how little tolerance is given to people who, through no fault of their own, become ill. And just to add to what you said, because we're a union that represents support staff now as well as teachers, we feel that a lot of our support staff who are working in very close one-to-one contact with children are some of the most at risk. And we've been hearing of, when you were saying about the data being distorted, in many of our schools, we're hearing cases where we've had cleaners where the cleaning team has been outsourced, or where the dinner staff team has been outsourced to a private company. They've come down with COVID and have been hospitalised and possibly even died, or family members have died, but it's not recorded within educational statistics because they're not directly employed by schools. So that's another thing.
That's really important. Yes, you're quite right, and that's really important to actually be including that. I think we all need to be documenting. Yes, definitely.
Okay, so there's another question here which I could combine. There's two that have come through and we'll combine them. One says, I'm a teacher and also a parish councillor, and the parish council is wishing to work with schools to combat air pollution. What can we do? And somebody else asked on air pollution, what next steps should reps take in schools?
Okay, by air pollution, I think well, a lot of people still mean, you know, just traffic pollution on the outside. I think the first step that you must make is to gather the information, find out what the issue is, what levels of pollution do you actually have, and then start looking at what can be done to reduce those, what can be done, and make sure you're checking what's going on inside as well. And then be very sure about, where those levels of pollution are coming from, and then look at what some of the solutions can be. If the levels are very high and your school is on a busy road or a main road, is it possible to look at ways of reducing traffic in that area around the times that children are going to and from school, or the times that they're actually playing outside? Is it possible to put up barriers, things like rows of saplings or trees, or wattle fencing with things growing up it? Those sort of things can be quite effective in terms of screening children from the effects of pollution that's going on in a road outside. But it's very much about getting all that information together and then looking at what you can actually do, but being very careful to always think about, particularly in rural areas where people have to use cars and things to get to places. So it's about doing that, I think, also in a way that isn't sort of punitive or doesn't involve being angry with people. If you're in areas where you can smell wood smoke sort of every night, it might be worth looking at what the council is doing about that. There are a whole range of things that you can actually do, but it's got to always start. Our position always is, as trade unionists, is start from collecting the information and being clear about where it comes, what's happening, where the pollution is coming from, what sort of pollution it is, and then thinking about solutions that can be carried out to do that. But it can also be about looking at what's going on inside the school and looking at how we can make sure we've got cleaner air inside school. In most of our schools, ventilation was rubbish beforehand, wasn't it? Absolutely rubbish. How many of you spend most of your time complaining about the temperature or the fact that it's stuffy by the afternoon, everybody's falling asleep? So all those sort of things. I think we have to use COVID to see how we can get our ventilation systems in our schools overhauled. And then if you can't just open the windows and get fresh air coming in because it's polluted, then there's more pressure on the schools and on the authorities, whoever's responsible for that, to actually look at systems of ventilation filtration systems, in order to make sure that the air the children are breathing inside the classroom is also going to be safe for them, as well as trying to reduce it and eliminate it on the outside.
Okay, now we have one final question. I think you're going to get about 1 minute to answer this one. It says in your slide you rate electric heating as zero polluting. This wasn't true when electricity was generated with coal-fired stations, and will not be now even when using renewable sources, as it does not take into account the polluting effects of making solar panels and producing the immense quantities of concrete required for wind farms and dams required. So could you enlighten us on that one?
Oh, that's very good, and well done for saying that. It's always a problem. I took a DEFRA slide, I think, there, and so I'm not responsible for producing that, but that's absolutely right, and that's really important, and we should always point all of that out. I think it's absolutely essential that we look at all systems from a life cycle point of view, from conception to beyond the grave, and actually look at all of the environmental and health and safety impacts of absolutely everything. You're absolutely right. Thank you for pulling me up on that. And as I was showing it, I was thinking, oh no, that's not entirely correct. You're absolutely right. We have to look at all the effects of absolutely everything. But the point of that slide really was just to show you how polluting open fires and even the DEFRA approved wood stoves are, because that's really important. And I have a particular bugbear, because I know that a lot of people who are very, very hot on reducing traffic pollution and cycle everywhere, pop home at night and fire up their wood stove. And it is important that we take those sorts of things into account as well. But thank you for that point. I take that entirely.
Thank you, Hilda, and thanks for your presentation and what was a really interesting discussion and question and answer session as well. We've got quite a few seasoned campaigners amongst our attendees.
Yes.
I just scrolled through the list earlier.
Yes.
And what's really satisfying is that during the current time with suddenly everyone's realised there's a thing called environmental pollution, and suddenly
Yes.
everyone's realised health and safety is actually a real thing.
Yes,
Not made up.
exactly.
And we all feel exonerated, but it's really great to
Yes.
have somebody like you that's been there from the beginning and sort of helped lead us in that. And it's, yeah, it's just been a really exciting afternoon from that point of view. Please vote for Hilda, influential health and safety practitioner. She's been nominated and she's standing against, believe it or not, Dido Harding and Matt Hancock, which is a complete travesty. So we need to share this really widely to make people realise what a proper health and safety person really looks like. And finally, all take back to your districts the need to subscribe to Hazards magazine. I've been reading it for years and it's brilliant. And it's another one of those experiences reading that magazine that makes you think, I'm not the only one that thinks this. This is true. Health and safety is a real thing. So thank you, Hilda, for that today. We've really enjoyed it. It's been lovely to have you. And thank you to everybody for coming and taking part. Bye-bye.
Thank you ever so much, Jenny, and thanks to everybody. That was absolutely brilliant. Thank you for having me. And do vote for me. It's a vote for all of us. It's not a vote for me. It's a vote for all of us.